Catherine. I was expecting you to read my mind, of course. So item 1 is apologies. George, do we have any apologies?
Yes, we've got several apologies today from Vivian Broadhurst, Teresa Levy, Martin Longley, Simon Raw, and Rachel Farrell, and John Selgren is going to be late to the meeting.
Excellent. Item 2 is declarations of interest. If anybody believes they have a declaration of interest, they should declare it now. If you don't have a declaration, that's fine. If you find that you have a declaration of interest as we're going through the agenda, it's never too late to declare an interest. So if one occurs to you because of the conversation, it really is important that you declare it, even if we're halfway through the conversation. Patricia, hello, you are more than welcome. Thank you very much. Item 3 is to confirm the minutes of the meeting held on the 9th of November. Does anybody have any issues with the accuracy or the content? In that case, can I have a formal proposal to approve the minutes from somebody, please? Yes, Mark is proposing. Can I have a seconder?
Seconded, Peter.
Spencer Flower. Instead of saying all those in favour, I shall ask is anybody against? Please indicate either by raising your hand physically or technically. No, in that case, as it's been proposed and seconded and they're voting for it, it's NEMCOM, whatever we have. Right, the next item is public participation. We have no questions, so there are no elements of that. The next item is questions from members. There are no questions from members. The next item is urgent items that were not on the agenda. Excuse me, there are no urgent items that were not on the agenda. The next item is the chairman's update, and I would just like to raise a few items which need to be recorded, and it may require people to think about if they want to do anything. So the Integrated Care Partnership is about to appoint a chair for the next 2 years. This is very important because it'll give the partnership a chance to develop its purpose, including how it intends to work with both health and wellbeing boards. A candidate from our local system was successful at interview and is to be recommended for appointment at a meeting this Friday. As soon as we have confirmation of the appointment, I am proposing that as Health and Wellbeing Board Chair, I meet with them to take forward the discussion about how we will work together. And without wishing to presuppose who this person is, if it is the person that I think it is, it will be a person that I work extremely well with and have done previously. So I'm particularly pleased if that is the case. But you have my word that I will work with whoever is put forward. The second developing issue is the ICS place-based partnerships. And I wouldn't normally, but Patricia, if you want to add a comment, because you were at this meeting that I'm about to refer to in a minute. These are required by legislation that set up the ICSs, and we're going to have 2 in Dorset, one focused on the Dorset Council area and one on the BCP Council area. I attended a workshop last Friday at which several leaders and representatives of local partnerships gathered together to start to think about how this partnership will work and what it will be focusing on. I think it was an extremely productive meeting, and the highlights from that will be shared and distributed to all members when they're published. The reason for this is really important, that the Health and Wellbeing Board is that we've already changed the constitution of the council to enable the board to be the strategic place-based board. Our role will be to identify priorities for improving health and wellbeing and health and care services for the Dorset Council area. So it's crucial we work together. I commend that you read the write-ups. You know, this was not a lovey-dovey, we all agree with each other. My first question was, can we actually spend a bit of time agreeing what place means? Because I'm not sure I understand it. And there was a general agreement that place can mean different things to different people. And I don't think that's work in progress as far as I can see. But I think we were all agreed that we need two place-based partnerships that work very, very much hand in hand with each other. And to that end, I have spoken to Jane Kelly, who is the chairman of the Health and Wellbeing Board of BCP, and we get on well. We understand each other. I would just point out that BCP has elections in May, and therefore it is not by any means certain who will be the ruling party, who will be the chair of the Health and Wellbeing Board. So as a matter of interest, I'd like it minuted here that as soon as those elections are complete, I will do my very best to make contact with the new chair appointee of the Health and Wellbeing Board, because I think we've made really good progress so far, but I think we want to make sure that it doesn't drop off because of political events. I've got a second item I'm going to talk about, but my style always, Patricia, is to give people notice if I'm going to call them in, so they've got a bit of notice. Did you want to add anything about the seminar that we were at on Friday?
Just to say, well, I concur with your view, Peter, and the place group is going to be a really important leadership team to act on the instruction of the Health and Wellbeing Board and really develop the plans around population health and the wider determinants at that place that's coterminous with the local authority, and the approach taken around co-design with the community is going to be absolutely critical. So the plan is that they would, once the work has been done, to develop the working arrangements, that those leadership teams will step up in shadow format for 6 months from October, with the view to them going live in April. And then we need to work through a maturity matrix process to decide when they have the capability in terms of leadership and the capacity to take any delegated authority down in terms of the decisions and the actions that we want them to pursue. But I'm pleased we've got this far. Actually, we've done a lot of work at system level around what place would look like, but not really got down to the two individual groups to work out what their responsibilities would be.
Patricia, thank you very much. That was very helpful. Patricia did the summary at the end of the session, and I'm very keen that it is perfectly okay for us to have our differences, but it's really even more important that we work together on areas of common interest, of which we've got hundreds, if not thousands. My next point that I want to discuss are health and wellbeing improvements. As my personal position is, I'm portfolio holder for adults and health, and one of my responsibilities is being the member lead for public health. And in this role, I was pleased to see the work developing to launch a really important programme for residents, the NHS Health Check programme. This was covered at the Joint Public Health Board that we held with Sam and others recently. Although it is branded as an NHS service, it is in fact commissioned by Public Health as part of the Council. The programme offers residents aged between 40 and 75 years the chance of a checkup to find out your risk of heart disease, stroke and diabetes. From this April, this service is being re-established at scale after it was paused during the pandemic. Most people should be able to receive a check from their local GP practice. For people not able to have a check from their GP, our health improvement service, Live Well Dorset, will be offering checks working closely with community organisations. This is a really important programme, and I'd urge anyone in this age range who doesn't know their cardiovascular disease risk to take advantage of having a check. I would also add that as the cabinet member, I asked Lucy Mears of Public Health Dorset if she could construct a communications piece that I could send to all members. She did, and it's an excellent communications piece. I've sent it to all members. Bear in mind, the meeting was Friday. It's now Monday. I sent it Tuesday or Wednesday. Sorry, I sent it out Monday. I've had a number of responses. Can I suggest that if there's anybody in this audience who has not seen that communications piece from Lucy Mears, you drop her a note at Joint Public Health and ask for a copy of it. The reason is that the comms piece she sent to me was very heavily emphasising the importance of members and how members could engage with the process to encourage better understanding of the process across the county. Now, it struck me as I read it, I could actually take members out and put, you know, anybody I deal with in public health affairs and in terms of health and well-being. You know, we've all got a role to play. So Sam, I'm going to call you in a minute. So I would suggest, and I'll put a note in the minutes, and I'll ask if you could make sure that George can make sure that Lucy's email address goes in, or just get hold of the thing she sent. I mean, I don't think it matters. Talk to me afterwards. So if everybody here could have a read of it, and if you feel you could take part in making that really important message more public, please do so. Sam, did you want to add anything to that before I close this item?
Only just a couple of minor points, Peter. That was really comprehensive. Thank you. Just to say, we did have this programme before the pandemic. It wasn't perfect. We have struggled sometimes to get good delivery across the county consistently, and of course with the pressures facing general practice and pharmacy, that challenge hasn't gone away. So I'm really pleased that we're now looking at sort of a community-based model working with Live Well Dorset for those areas that might not be able to access the service via their GPs. I think the other point that I'd make is it's not just about the NHS Health Check service as a single commissioned service. There's a national priority around cardiovascular disease prevention. I know the ICB is working hard on its cardiovascular disease plans, and we're helping where we can. There is something about that just general advice to people. Do they understand their blood pressure? Have they taken advantage of some of the new models that are being offered? So pharmacies are offering the opportunity for people to take their blood pressure, as are general practices. So as a first step, understanding your baseline blood pressure is probably one of the most important things that people can do. And we've all got a role in, as Peter says, amplifying that and making sure that this is a real sort of community-led issue. Thank you, Peter.
Thank you very much, Sam. That's the end of the chairman's update. The work programme, which is on your agenda, on your papers at page 11, I'm going to do this in two parts. I'm going to ask if there are any questions related to the work programme as you see it. And forgive me, I'm going to use Chairman's prerogative to come back to it later, because there are some issues related to the sessions that we're going to hold for both this Health and Wellbeing Board and the BCP Health and Wellbeing Board, which, for reasons which we will explain, will not be synchronous. They will need to be slightly different at slightly different times. We're looking for the end outcomes to be the same, but because of primarily the election of new members, there will be differences in the way we move forward. So please understand, I'm not trying to be a poor chair. It's just I think it will be relevant to come back for it later. But is there anything in the work programme? Does any member want to raise something, either as a question of clarification or as we need this in the work programme for the future? I'm happy for any means of shouting, raise. Sam, come on in.
Thank you, Chair. I think my general comment about the work programme and the forward plan is that it feels as if we're in a transitional period at the moment. We're going to take an agenda item for decision later on in the board, which talks about some of the new responsibilities coming to health and wellbeing boards and the importance of perhaps reviewing our forward plan and our work programme in the light of some of the wider developments, including refreshing the joint health and wellbeing strategy and also working with the ICB on the development and delivery of its joint forward plan. And you also talked about the importance of that place-based work as well. So there's lots to think about. And I think over the next few weeks, as that becomes clearer, we'll start to identify a suitable time and date when we can get together as a board and have a much longer session, I think, working through what our forward work programme should be over the next couple of years.
Thank you very much, Sam. Chris, come on in.
I noticed in the strategy later on it talks about engagement with BCSE sector. I didn't see anything in the work plan really to start that engagement. I think it's very important we actually start that very quickly, because I think there's a lot of work that can be done in parallel with what's going on here to get local communities actually up and running.
Kate, your point
I
is...
I missed something.
No, your point is well made. The work plan does tend to be rather binary in its presentation, but I absolutely accept that there, members shouldn't treat this as it's binary, so I don't need to think about it until when it comes up. Did anybody else want to comment on Chris's point? Okay, thank you for that. So as Sam, far more eloquent than me, explained why we might come back to the work programme. I thank you for that. The next item is the Better Care Fund. And Sarah, Sarah Sewell, to my left, your right, if you're looking at me. Sarah is going to do a short presentation. She'll put it up and it's over to you, Sarah. Can I suggest that you, unless it's absolutely essential, you ask questions at the end, please? But, I mean, if you can't see it, ask them in the middle.
Thank you. Good afternoon, everybody. I'm Sarah Sewell, Head of Service for Commissioning for Older People and Prevention. Just got a couple of slides here just to take you through the paper in the report pack. So this is in relation to Better Care Fund, the discharge fund that we received in December, and also our progress on planning of how we may start to align funds differently in the future. So just as a quick recap, on where we're at with the Better Care Fund, kind of the purpose, etc. So the BCF is an important funding stream for all local systems, and it's a key tool for integrating health and social care services in our working approaches. It requires us to pool budgets and develop one integrated spending plan to drive forward our shared priorities, and that's particularly around prevention and promotion of independence. This financial year, just to kind of give you an idea, or just to reconfirm the scale of the funding, it's provided the Dorset system with a total of £139 million of funding, and within the parameters for how we receive that funding, we're required to set joint annual spending plans as between the council and Dorset NHS for investment, although we are looking towards moving those planning cycles to 2 yearly in the future from next financial year. The BCF mandates conditions for the investments, and there's set policy objectives and reporting cycles that we have to comply with. And it's not a surprise, but those BCF objectives, they echo our local shared priorities, which I've just noted there on the slide, around enabling people to remain well, safe and independent at home for longer, and to provide the right care in the right place at the right time. So just in terms of today's paper, we're looking to seek retrospective approval of the adult social care discharge funding that we pulled into the BCF as we were required to in December, and also to provide you with an update on the work progress to date in relation to identifying opportunities to broaden how we use our Better Care Fund investment in future years. So the first element is around the adult social care discharge funding, which was announced by the Department of Health and Social Care in December. And it provided us with additional funding of just under £4.6 million, which we were required to invest into services and initiatives by the end of the financial year that would maximise the reduction of delayed discharges from hospital. A condition of the funding was that we pulled that into the BCF budget, and that we submitted spending plans that needs to be approved in line with the BCF governance, which is obviously through the Health and Wellbeing Board. We had some tight timescales associated with submitting those plans, which is Appendix A of the report pack. Therefore, the submission was made under our delegated approvals in line with Councillor Wolf as chair, and there's some additional ongoing requirements to report fortnightly, which we're still in the process of doing until the end of the financial year, on the discharges and activity that we're achieving through the funding. So that's why we're coming back today to seek that retrospective approval of the plan. That's the first recommendation, which I'll summarise at the end. Oh, bear with me, my screen's stuck. There we go, that's it, sorry. So the second recommendation today is around the opportunities for realignment of the BCF investment. So our current plans describe our ambition that we share across health and social care to use the BCF differently in the future. And we want to deploy that into new and different approaches. And that includes investment into an all-age commissioned approach, and link that more closely with population health and health inequalities work streams. We've detailed in the report under 2.4 some of those areas that we want to focus on, and we've formed that working group of officers to start to work that through. So in summary, the two recommendations within the report today is that retrospective approval of the discharge fund plan, which we've pulled into the Better Care Fund, and to note the progress to date of the working group that we've formed to identify those opportunities to realign funds from the next financial year. And we propose to bring back a further item to a future board meeting to update on that.
Thank you, Sarah. I'm going to ask an individual question. When it says to receive a further item at a future health and wellbeing board, I would not like it to be too many health and wellbeing boards in advance. So can we assume we'll receive either the item or an update of the item at the next health and wellbeing? Yeah.
Yeah, I think it's part of the work programme as well.
It's more governance, because if you read that paper and you were from Mars, you might think it might come next year sometime.
Yeah, it is.
Okay, Jonathan.
Yeah, I mean, it's on quite a regular cycle, reporting back to the health and wellbeing plan. So as it's developed, and hopefully this year, because we're looking at a 2-year scheme, we can get ahead of the deadlines that are set by the NHS for submission. But we could have drafts coming here, so everyone is lined up.
Okay, thank you, Patricia.
Thanks, Chair. I think it's just worth noting that there were 2 tranches of money that came down from the Treasury this year to support discharge from hospital. One rolled into the BCF and the other one not. There's a really clear mandate from the Department of Health and Social Care that in order for the funding to be made available for 2 years, that they need to see a reduction in patients in hospital that don't meet the criteria to still remain there, as in you know that I'm not a fan of that as a measure, because for every person waiting to be discharged from hospital, there are 4 people at home not receiving care. And I actually think that the focus from DH on the back door is making the problem worse. And I've fed that back up to the centre, but we do have to find a way of being able to satisfy that criteria in order to continue to receive that funding. And at the moment, our no criteria to reside across the 2 acute trusts in the last 3 or 4 weeks have reduced by 1/3 because of the schemes that we jointly put in place. So I think that's a real positive.
Thank you, Patricia. And you know how closely officers here are working with your people to try and improve hospital discharge without just acting in a way that just clogs up another part of the system somewhere else. And for the avoidance of doubt, I completely agree with your analysis. We need to solve the whole process rather than just one part of it. So we've got one very important recommendation. We agreed the budget because we were in a bit of a rush and there were rather a lot of things going on, and if we didn't agree it, we wouldn't get it. But nevertheless, it's important that from a governance point of view, this board are happy with it. So I'll be looking for agreement. And the second thing is that the working group will do work which will, and this is going to align with the next item that Sam's going to present about developing a work programme, because the working group needs to position the Health and Wellbeing Board so that we are in a place to meet the requirements for, being place-based and doing what we say is our job, if that's not too right. Are there any other thoughts on this, which I think is fairly self-evident? If there aren't, can I treat the items separately? Okay, so the first thing is we need to approve the discharge, the BCF fund. Can I have a proposer for that, please? There's a stunned silence.
I'll propose, Chairman.
Thank you, Spencer. Can I have a seconder, preferably somebody from outside of Dorset Council? Mark, thank you very much. Okay, that's seconded by Mark House. All those in favour, please show. Brilliant, yeah, and Mark, I'm assuming your hand's raised. Anybody against? No. Any abstentions? No. Fine. DEMCOM. We don't need to vote on the noting of the progress, I don't believe, but tell me if you think we do. No, we don't need to vote but does anybody dispute that we need to note the progress and we look forward to the outcome of the joint officer operation? With great interest, Sarah. Right. So every time I pass Sarah, I will ask her how her twins are doing and how the report's doing, because the twins are more interesting. Sorry. So the next item is developing a work programme for the Health and Wellbeing Board. And this is a very, very interesting item, because when I did all the work on the papers on this, we could have had them in any order, because any paper helps other papers. Now, the point about this is that we need to understand the new responsibilities and duties of this board, and we need to think about development sessions to take us forward. So my name is portfolio holder, but as is often the case in local government, the man or woman who's done all the work is somebody else entirely. And Sam, I hand it over to you because you've done the work, and I thank you.
Thank you very much, Peter. I'm actually going to do a double act with Sarah Longden. Sarah's going to take us through the kind of main content of the paper. I guess I'll just introduce it very briefly. I think we're at an interesting period, and when I kind of think back to the way that health and wellbeing boards have developed over the years, I was quite struck a while ago by a comment in a King's Fund report, I think, which they were looking at the forthcoming legislation that was going to make integrated care systems statutory. And the report said something along the lines of the Health and Wellbeing Board is now an idea whose time has come, because this really should be the place where we are working better together as the NHS, as councils, as communities, all of the organisations that make up that partnership. So this paper is very much recognising some of those changes. The legislation that came out last year did not remove the existing statutory responsibilities of health and wellbeing boards. So what you've got in here is a kind of recap on what the board should be doing according to the 2012 Health and Social Care Act. But Sarah's going to walk the board through some of the new responsibilities that are going to come to health and wellbeing boards as they're slightly repositioned in the light of the changes in the system, not least on our work programme. We are going to have to find some time to consider things like the Integrated Care Board's forward plan. There's a number of other responsibilities, but I'm going to pause there and hand over to Sarah rather than taking you through the main points. But I hope that at the end we could break in and perhaps have a bit of a further discussion as to what we should think should be included in this work programme. But the most important thing is going to be us having time together as a board to really start to understand in detail what that might look like. But over to Sarah. Thank you.
Thank you, Sam. Thank you, Chair. Yes, so just to take you through this brief paper, purpose of which is just to set out for clarity where we are at this point in the changes and the integrated care system, and this is an opportunity for Health and Wellbeing Board to refresh itself, take on board new responsibilities, and use this opportunity to really make a difference and get some really interesting work through in partnership together to make a better difference. So as Sam has mentioned, so there's some background as to where we are with health and wellbeing boards and how they've been set up. 1.4 just goes over existing responsibilities of the health and wellbeing boards, which the board has been fulfilling and will remain in place, and they don't change. But 1.5 just sets out new responsibilities under the new guidance. So we have alluded to these points, taking into consideration now the Integrated Care Board forward plan, and being consulted on Integrated Care Board performance assessments, and receiving a copy of the Integrated Care Board Joint Capital Resource Plan. I think the next point is of interest when we talk about a development session and looking at what our forward plan for the Health and Wellbeing Board would include. So the Health and Wellbeing Board, taking into account the integrated care partnerships and the integrated care boards, to determine integrated approach, deliver streamlined care and prevention activity at place. So this board being the responsible body for the place and what we need to, how we can work together to really deliver these activities. We mentioned, Chair, on Friday we had a place-based session where we started to think about what that could be. So understanding what that is and then how we can incorporate that into our forward plan in this board. It's early days, but we do want to be able to move on quite rapidly. It is a changing landscape, but we shouldn't use that as a reason not to move forwards and be clear on what we want to achieve. So with the integrated care system and the partnership, which is the integrated care strategy, which is the next item at a system level. And then we have at place level both health and wellbeing boards, and then our organisations, our communities, and our partners all working together. There is opportunity for confusion and different understandings of what we're all here to do and how we work together. So I think a key part of our development plan and our development session is to really understand clearly the role of this board and how it then connects with these other entities so that we can move forward clearly. So I think the next section, positioning the Health and Wellbeing Board, covers that. So 2.4 just clarifies that we need to be clear about the role, purpose and work of the Health and Wellbeing Board. We talked about working in hand in hand with the BCP Health and Wellbeing Board as well, and understanding the overlaps and where we connect and where things then move up to a system level as well. But there is a diagram under 2.6 to just illustrate that briefly. So the Health and Wellbeing Board development, our responsibilities, the development session to understand that and think ahead to what the work is that would be overseen by this group. And then on the left-hand side, how that would then fit into other key strategies in the system, notably the ICB forward plan, the integrated care partnership strategy, which is the next agenda item, the local authorities plans, and other partnership and joint strategies in the system. So that's the context, and that's the recommendation that we look at all of that. We make sure that we're clear on what that means and what our role and responsibility is. And we need a bit of time to work through that. So I think that covers the report and the recommendation.
Okay, can I? And Sam, you and I have spoken at some length about the sequence of these events, and it's quite interesting because we need to be clear as to what the ICP strategy is before we move forward. We then need to develop our own Health and Wellbeing Board strategy. We probably need to develop ours at a different pace from BCP because we're a relatively well-formed board and there'll be no change in personnel, whereas the BCP one is likely to have a change in personnel. So it could be that their first meeting is to learn, and I often use this, is meant as a sort of slightly trivial joke, learn how to spell Health and Wellbeing Board, because they'll be introduced to it. So they will need to do that before they can get on to the second order. How is it we're going to work? And that means we'll be at a different pace for a little while. So I'm going to, Patricia, if you don't mind, I'm going to give Sam a little go because I want him to talk through what he sees as the timescales, and then I'll bring you in. Sam.
Thanks, Peter. Yeah, I think the point about timescale is an interesting one, isn't it? As you mentioned in your summary at the end of Sarah's presentation, there is a sequencing to this. And one of the other issues is to have a better understanding of the kind of clarity of purpose for the integrated care partnership. What is it that we're going to do as a partnership, Pandorse it? And then what is each Health and Wellbeing Board going to start to sort of bite off, as it were, recognising that those priorities might be slightly different in each place, and the way that we work and the resources available might be slightly different, requiring different solutions. So I don't think we're going to get this right all of a sudden. It's going to take time, and there's no substitute, I think, for time spent together in working through and understanding this. Above all, having clarity of role, responsibility, and which work is being picked up where is really important to avoid duplication and confusion between these plans. And that's always a risk, isn't it? When there's a big system change, we've got a whole load of new acronyms to chew over and swallow, but it doesn't detract from the underlying tasks that have always been the same. What is it that we want to do in each place? What are the outcomes attached to those activities, and how can we really start to sort of channel our resources to make the most impact for residents and be clear about what we're doing public in reporting back on progress as well. I think that's really, really important, and that's a really key role for health and wellbeing boards in particular, to sort of hold the mirror up to the system and say, we said we were going to work on these priorities. Actually, what's the progress that we've made in the last couple of years? I'm going to pause there. It'd be good to hear from Patricia, but those are my thoughts. The ICP development session needs to happen. Then we'll have time as each health and wellbeing board, and of course, as the place-based partnership develops, I'd expect that to start to become a really powerful work programme over time.
Thank you. Patricia, sorry to keep you waiting.
It's all right. It's really cruel when you make me follow Sam. He's very So I think when we think about the legislation that came in July, it's becoming a really complex landscape between what NHS England are being asked to do in the Care Act and what the wider responsibilities are of integrated care systems and partnerships. So I think one of our jobs as system partners is to try and make sense of that, not just in terms of how we want to work, but then engage our people in our staff in what role they have to play, as well as supporting them with understanding that the way we engage with communities might be very different going forward. And we've had some of this conversation in the Patricia Hewitt review, because that review that will be published in the next few days really does recommend turning ICSs on their head, basically, to have a very small number of national priorities, and that everything else should be driven locally by communities. So I think we've got the ICP strategy, as Sam says, and we've got the 3 strategic aims within that, which are prevention and early help, thriving communities, and working better together. Then we've got the NHS England priorities, which have been produced in their planning guidance, and we have to submit as health organisations an operating plan that has all the detail of how we're going to deliver on a number of targets, as well as a break-even position. But we've also got to submit the ICB 5-year forward view, which is, I think that is more about a narrative that describes how are we going to deliver on population health and health equity through that lens of social and economic development. So that's a much broader concept than just the NHS priorities. And we spent a day on the 20th of last month with all system executives from health, local government, and the third sector and primary care to look at what we considered to be 4 or 5 priorities that would sit in that 5-year forward plan. And all those priorities are focused on health equity. 3 of them look at children and young people, because we need to get on top of that if we're not going to repeat the evidence and the view of the Marmot review 10 years ago. And then the other 2 focus on different sections of the population. And I think there's something about us, first of all, trying to align all that so that what we're not doing is trying to deliver multiple transformation programs that we won't have the capacity to do in terms of leadership or transformation. But we need to make sure that all of those work programs, whether they're health ones or through the targets that are set, or the 5-year forward plan, or the ICP strategy, that we are resetting the context for those programs of work to make sure that they're not just dealing with a response to ill health, that we're getting earlier upstream and actually they're bedded in population health, prevention, early help and health equity. And that will be a fundamental change for the way that health services, not just in Dorset, but nationally operate. And we know we've got work to do, particularly with our providers, in getting them into the space of understanding their roles within systems will change significantly over the next 5 to 10 years. And for me, the Health and Wellbeing Board is absolutely critical to this work, because we need to have a conversation around what do we think it's right to develop and deliver at a integrated system level, and what do we think it's right to deliver at place. And certainly what I've said to the health partners is, whilst we might develop models of service that are Dorset wide so that we're guaranteeing that every person has the same experience and the same outcome, the way that we deliver those service models should be determined at place by community needs and how they want to and can access service according to their geography. And that means that we may well operate a process of moving away from equality of access, because that is exactly one of the reasons in the NHS constitution why we've ended up where we are with health equity, that we have to start to recognise that differential investment needs to be a principle that sits underneath the ICB if we're going to make some serious inroads into population health.
Okay, thank you, Patricia. That was very, very helpful. Can I just add my own view of the timeline so that my style is to try and get things so I've got it clear in my timeline. So if board members are issued with the ICP strategy to read as their homework, if we as a Health and Wellbeing Board have our first development session, I suspect it would need to be, and I discussed this with Sam, so hopefully we've not disagreed since I talked to her. I suspect it would need to be towards the middle end of May. Ours would be quite different from the BCP development session, which I think would probably not be until in June, because they have an election and then various things, and who knows, the election may not be clear or whatever. And then we need to have a joint health and wellbeing development session where we all get together and we agree, because we've got far more to agree on than we have to disagree on. We may have a different demographic, but you know, most of the other things are the same, more or less. Sam, did you want to just comment on that, please?
I think that's achievable. Perhaps one of the things that Sarah and I could start to work on is a draft proposal for the timing of some of these development sessions. So Sarah's supporting me in developing both health and wellbeing boards. As long as we're not rigid, we might have to shift timings a little bit, because there is a bit of a sequencing around making sure that we're doing the right things in the right groups. But it might be helpful for us to start to draft up something that puts some of those key dates in for development sessions alongside the published calendar of formal health and wellbeing committees, which I think we've already got, haven't we, for 23-24. So I'm happy to take that away as an action, Chair.
If you could, Sam. So that's why we were discussing the work plan here as well as earlier. So Sam will put together some suggested dates, and can you put a series of hooks in for us to think about? Because I think rather than just turning up on the day, I think some sort of, sorry to say this, and I don't mean to sound teacherish, but some pre-homework to try and prepare us for what it is we expect to get out and what we need to come with thoughts on. That would be really helpful. We are, and again, I think Sam and I agreed this, so if you disagree, please shout. We'd like that to be in person, because I think, you know, there are certain things that benefit from face-to-face, particularly when you're developing plans, and it's often the sort of third order question that is most interesting, and you tend to not get that when you're too far apart. Which doesn't mean to say people can't attend virtually if that's what's the only way, but we are going to look to try and get everybody in the same room, or most people if at all possible. And we will, obviously I will need to be in close contact with our colleagues in BCP to try and make sure that they buy into this. And I've already spoken to Jane Kelly, and she buys into it in general. But as you all know, no government can bind the hand of its successor. So when we get a new administration, whatever, I didn't mean to sound like some 12-year-old, whatever, at BCP, we will need to, in some sense, start from scratch in our discussions with them, which presents its own challenge, Andrew.
Yeah,
right.
Okay, can I come on?
Yes, please, Andrew.
So I think we've got to be prepared for some fairly challenging conversations and courageous conversations amongst us, because from my observations, wherever we see, where we have clearly defined roles, we're all very comfortable in those spaces. The challenge we always find, and where we come up against each other, is those grey margins in any organisational setup. And the fewer margins that we can have, the better, in my view. So this is politically, be it politically or operationally, we need to figure that out for ourselves. So when we have this meeting and this conversation, please don't shy away from the fact of thinking, well, if the councillors are in the room, we must tell them what they want to hear. Frankly, that is the route to failure of any project. It's much better to come in and honestly say, actually, if you as councillors don't do this, or you do this, this will be the repercussions to us. If we understand that from the outset, then we can get a much better operation. So any successor authorities to us or successor cabinet members to us are in a much better position to ensure that we succeed for our residents.
Thank you for that, Andrew. And can I add, local government has its own cultural quirks, and dare I say it, the NHS has its local cultural quirks. Surely not. And what we need to try and do is, I think we've just got to be completely honest about it, because we're not going to resolve them or change them overnight, but we need to find a way to work more effectively with each other, taking into account the fact that we have to be representative of people knocking on our doorsteps. The NHS doesn't have quite the same effect, but it has other similarly difficult aspects to how it operates. And I think to some extent it might be an idea, I direct this to you, Sam and Sarah, might be an idea to have a, part of the first part of the session is to try and just be honest with each other about what works, what doesn't, what irritates us, what doesn't, what gets in our way, because sometimes, it's a bit like marriage guidance. The start to successful marriage guidance is recognizing what the underlying issues are. And I don't think they're any dramatic. I hope Patricia doesn't disagree with me, but I do think we need to be completely honest about it. And same for the fire service, same for all of our partners. They may have issues that they think we don't quite understand, and it could be that's because we don't understand it. Patricia, you've just come back on screen with that mischievous smile on your face, so you haven't put your hand up, but I suspect you want to say something.
I agree. I think, Sam and I talk about this all the time. Obviously, I've got the worst of two worlds. I had a mother from the north and a father from the Caribbean, so you can't get more plain speaking than that in our house. And we don't do enough of that, and not to criticise each other, but in a respectful way, so a place of shared understanding and how we can move forward together. So if we're going to meet and create a safe space, I absolutely would support us having some honest conversations, because then we can start to change it where we need to and get a better understanding actually of each other's challenges.
Yeah. Patricia, thank you for that. I'm always slightly nervous when I call people in, thinking, oh, they might not support me and I might get the rug pulled from me. No, that's really helpful. And bearing in mind, I'm a northerner as well, and my wife's from Bristol, which might as well be the Caribbean. Oh, she's just heard what I've said. Does anybody? So I think we've got a clear set of actions. We understand what the likely timeline is. We understand what our roles and responsibilities are, to read the ICP strategy, to come prepared, to be completely honest, to walk away with a strategy for our health and well-being, and then at a later development session to work with the Health and Wellbeing Board of BCP, so that we actually do things sensibly where we have common interests, which are more frequent than most people say, in my view. Okay, so we've got this particular item is to note the responsibilities and duties of health and wellbeing boards, which Sarah very eloquently explained, and to agree to hold a development session to consider the ICP strategy and develop. It says identify other items for a work programme. I think we've expanded that much more so that we have some decent input to how we move forward. Is everybody happy about that? Do I need to seek a formal? No. No. Can I just test the water? If anybody is disagreeing with that as a way forward, can you please say something? And I work on a very old-fashioned basis. Silence is assent. Right. In that case, I think we've agreed item 10. Item 11, update on the integrated care system and next steps for implementation. Sam, do you want to introduce this?
Yes, thank you, Chair. So this is the first time that we've brought the Integrated Care Partnership Strategy before the Health and Wellbeing Board. And the purpose of the item today really is to introduce the board to the strategy. I'm not going to talk about it in a huge amount of detail, but I do want to spend a little bit of time on the background to deepen the Health and Wellbeing Board's understanding of how we've got to this position, how and why we built the strategy in the way that we did, and to talk a little bit about next steps in implementation. We've covered quite a lot of the ground already because the whole meat of this meeting mainly has been about how the board is going to be looking forwards, developing a work programme and thinking about the interrelationships between these new parts of our system that have been brought forward through the legislation. But I'm very proud of the strategy. It wasn't just me involved in delivering it. We had a really strong team that met as a task and finish group. In fact, it took the best part of a year, to be honest, to do the work involved to develop this strategy. And I think, as I've said to the board at regular intervals during the past year, as we updated members on the progress with the strategy, we deliberately set out to try to do it quite differently to how we might have previously worked on system plans. I remember being involved in previous system plans where there was a real temptation to follow the national guidance or NHS England guidance that says the strategy must contain the following, and you end up sort of parroting back national guidance, which doesn't really give a flavour of what the local challenges are, how local people feel about their area, some of the issues and some of the health challenges that they face. So right from the start, we felt it was important to be different and to behave differently in developing the strategy. So we used a 3 workstream approach. There was a research workstream, which you'd expect, which links back to looking at the evidence from Joint Strategic Needs Assessment, which of course is a responsibility of each Health and Wellbeing Board. But the 2 other work streams I think were really important. The first was taking a long time to engage with system leaders, not just in the statutory organisations, but also leaders from voluntary sector, in trying to sort of keep circling back with what we were trying to do, what was the purpose, what should be in the framework, and perhaps more importantly, what shouldn't be in the framework, so what wouldn't be important. And at the same time, we carried out a very different way of talking to the public about strategies. So instead of drafting a strategy and then running a consultation event or a series of consultation exercises, Kirsty Hillier, Francis Avis, Chris Ricketts and others supported the team in developing this process called 100 Voices. So this effectively was training a number of people in our system to become expert interviewers. They used a motivational interviewing technique and they reached out and engaged with 100 people from quite different walks of life. And we worked very closely with a range of community organisations to find some people that we would never ordinarily speak to in the course of developing this kind of strategy. And so that evidence base was built up, not only of the hard facts, if you like, about what we know about health and wellbeing in the Dorset and BCP council areas, but also insights from people who were talking to us about their everyday experience of health and wellbeing, the sorts of things that help them stay well and help them stay healthy, but also the things that get in the way. And along the way through those conversations, a number of themes emerged that became quite similar the more we did what's called sort of grounded analysis. So the strategy is really a combination of some outcomes that we feel we ought to be making a difference on from the sort of hard research perspective, if you like, knowing what we know about health and wellbeing in our two places. But increasingly, I think the insight that was brought through from that public engagement exercise will be the issue that makes a real difference in this strategy. And I've said all along, it's not really so much what's written on the paper, it's how we start to change the way that we behave as a system. And the most important thing, in my view, will be to continue to commit to not only listening to residents and communities, but actively involving them in the development of some of the solutions of how we do work together differently. So I'm going to move on and just talk perhaps about where we are in terms of strategy implementation. In January, we met as an integrated care partnership. That was the first time that the ICP met to consider the strategy. Alongside the discussion about the strategy, I also was at pains to sort of ask the integrated care partnership, were they happy if I continued in the role as senior responsible officer, not only for delivering the written strategy, but now starting to work on the implementation phase. I thought that was important. It's a bit like a break clause, isn't it, with a provider? Are you happy with progress so far? It gives the ICP the opportunity to consider whether the type of work that we need to do in the next phase is so different that another leader would be more effective in that space. I'm really pleased to say that the ICP endorsed me continuing in this role. So I'm now starting to work with the same team to start to think, how do we move into implementation? So under section 2, you'll see there's a number of points about how we're starting to think about moving into implementation. We're going to use a similar structure around the work streams, so there'll continue to be the need to continue to do some research around understanding what are the evidence-based interventions that could be taken forward by different organisations and different plans and strategies as we start to unpack the strategy framework. But I think the most important thing is that continuous engagement of system leaders, continuing to connect people with what's our real purpose, how do we simplify and really combine our resources to do less well, really. There's a comma in there, to do less, comma, well. I think, it is a complex system, and I think the more we can be clear on where we feel that we can really make a difference working together, the better and the quicker we'll start to move some of these outcomes. And then the third one I've talked about already, which is that importance of that ongoing engagement. So I'm really pleased with the way that the Integrated Care System Engagement Network is developing. Our intention is to really start to continue to work with the people who stepped forward to share their experiences and find ways of continuing to involve them as we start to think about solutions and different service models. If we're not doing that with people, then people won't feel that it's for them. And I think that's really, really important if we're going to increase engagement, increase people's literacy, and increase people's commitment to what they can do to stay healthy, as well as what we deliver as statutory partners. So not going to talk in too much more detail, other than just to say, obviously, as the Integrated Care Partnership welcomes its new chair, hopefully on Friday, a parallel piece of work that will be going on, as well as the Health and Wellbeing Board development sessions, is to meet as an Integrated Care Partnership to consider the strategy and to start to think about the development of the ICP. What is it that the ICP is really going to stand for in the light of the strategy? And then how do we provide or leave a bit of space for each of the Health and Wellbeing Boards to then surface what's important in each of those places? So we've already committed in the previous paper to having a development session as the Health and Wellbeing Board. I'll just urge board members to take the strategy away. Please have a good read of it. It is not perfect. It's not the finished article. It was always intended to be quite a live document. And as I said right at the start, please view this as a framework and a set of guide rails, if you like, for understanding how and where we should be working to improve outcomes for residents. It's not the definitive article. It's the behaviours and the actions that fall out of it that are far more important than the piece of paper. So just to move to the recommendations, Chair, we're asking the Health and Wellbeing Board to note and support the integrated care strategy and to endorse the framework for securing the fastest possible improvements to the health and wellbeing of residents. We're asking for board members to agree to consider the strategy at its development session, which we've already covered in the previous paper, and to note and support the next steps in implementing the strategy as agreed by the ICP. And my personal plea is for all organisations, if you're a leader representing an organisation in our system, please do continue to identify some good people to come and work with the strategy implementation team, because it's really important we get that depth of understanding of the strategy through some very, very different organisations across our system. And that means we have to absolutely be working inside and with those organisations, not doing it in a dark room off to the side. So I'll pause there, Chair, for questions and comments, but I hope the board would support the recommendations.
Thank you, Sam, and I particularly agree with Patricia's earlier comment about never good to follow Sam, because you've always got this lovely mellifluous tone. Can I put it slightly differently? This is your homework. I'm really wanting, if you're going to be a really valuable member of the Health and Wellbeing Board, you've got to read this strategy and really understand it and be prepared to agree where you want to and disagree where you want to, because this is the start of a journey. And unless you're a Strictly fan, you will know, you may not know that the journey is more important than the end. I would just point out that this is a living document in every sense. You can see it. If you look fairly early on, you've got 3 pictures. You've got Jenny Douglas Todd, who is the interim chair, who will be replaced shortly. You've got Drew Mellor, who was the leader of Dorset, who has gone.
Leader of where?
leader of PCP. I'm sorry, I've been Andrew just garrotted me. And then you've got Spencer, who, by the way, isn't going anywhere. So, but what I'm trying to demonstrate is that even in a small way, things move on, things change, and it's important we recognise that this is a staging post in our journey. It's not a you must agree this absolutely. So, A, can you have a good read? B, can you engage? So, you know, I'm looking at people like Mark House. I expect you to share this with your fire service colleagues, because what I'm wanting is that I don't only want the fire service to be engaged. I want the fire service to know that it exists and to feel that they have been engaged. We'll do the same here. All partners, please do the same. And then we'll pick it apart at our development session. And I look forward to that. And we'll then use that as a mechanism for agreeing our overall strategy and thinking about the way forward in terms of the steps forward. So I don't want to discuss it right here, because I think it would be an inappropriate place. But I do want everybody to be aware that this is something that is well, it's absolutely essential. You can't, you know, we have occasional members who turn up to meetings and don't read the papers, and they can be irritating, but we can generally get by without them because enough people have read it. I need everybody to read it, because we must go forward as a single unit. Does anybody have any other comments?
I need to pick up on it again.
Yeah.
Delighted that Sam, you've got the confidence of those around you to remain in your post to see this through. That's very reassuring to the rest of us around the room. But equally very conscious that an awful lot is asked of you and expected of you, and you magnificently have this swan-like grace of floating across the water whilst paddling furiously underneath, working 28 hours a day or however you do it. What I want to ensure is that you feel you can say to this board, you need, if there's any points in time where you feel you need additional support from us or resource in there to help see this through to conclusion.
Sam, do you want to comment on that before I call Chris in? Sam?
No, just to say, I think that is absolutely the point. Thank you very much, Andrew. It is really important that I'm not out there in front and there's no one behind me. We can only make this work if we can bring people with us. So having that support of the board will be really, really important. So thank you for that.
And just to add to Andrew's point, you are a relatively small directorate, and there will be occasions when you could do with support. And whilst we're not awash with people, the fact is we can give you our encouragement, our engagement, and possibly some assistance. So, do feel free to do that. Chris, come on in. Chris, your microphone's not very good, so do speak up.
Okay, right. I will. I did read it. I thought it was an excellent piece of work, particularly the content in there on VCSEs and local communities. One of the things I did notice was that obviously this is coming down from a health and wellbeing perspective. We work closely with communities, and they often have to look at the overall sustainability of a community. And that includes things like skills and education. It includes things like transport, economic development. So one of the things I think will be quite important here to consider is potentially investing in communities to be able to develop things like the old-fashioned town plan or parish plan. So you look at each of these sectors because they all interrelate. So if you want to get an outcome from health and wellbeing, a local community may have to think of several factors that have to come together to help deliver this. So I think one of the things you might consider is actually investing in communities, helping them to develop that type of local plan, and then that will help to integrate what you're trying to do.
Yeah, thank you, Chris. And John Selgren, I can see you're on board, and I don't wish to catch you out, but I think Chris has raised a really relevant point. He touched on the local plan, and I think at our development session, I think because I have to be honest, there are some people who don't understand what a local plan is and why should they, but actually it's an essential part of the place framework. John, go for it.
Thanks, Peter. I mean, we would certainly find it a very useful.
Your mic's.
Sorry, it seems to be the technological issue of the day. For some reason, the session I've just come from, it's over my shoulder. I was on not using the kit, as you heard earlier in the performance board. For some reason, some meetings need the headset. So here we are, back on headset. So flight 62, you're cleared for takeoff. So yes, it's always we always welcome the opportunity to talk about how the local plan provides that glue. It's really important. This is a plan which will shape this community 10, 20, 30, 40 years out. For that reason, it's absolutely critical that as we shape that plan, obviously being a statutory function of the council, as we shape that plan, it needs to be done with all our partners and stakeholders engaged. So we need to know what your service plans and your thinking is for the future. We need to ensure that we've anticipated not just the current, but for the future needs of our community, and therefore that, when it is, and it will be our grandchildren are walking the good environments of Dorset in the future, that they've got the sorts of services that we have left them as a good legacy. So it's that. So Peter, if it would be helpful for us to perhaps do a little cameo into one of your future meetings to perhaps talk about that, and in particular what I would want to do is to talk about where board members around this table can engage with that process and how you can do it. We would be absolutely delighted indeed. We would positively welcome it.
John, that would be very helpful. And can I ask that you do the cameo at our development session, because it just feeds into it completely. It doesn't need to be hugely long. I think it'll generate some questions. Those of us that have got the local plan tattooed on what's it will understand it. Some of the people won't, and it's actually be quite instructive, because Andrew and I get people knocking on our doors at 11 o'clock at night saying, how dare you do this? And it's quite, well, it can be frightening. Yeah. Okay.
And again, Peter, you'll know, and it's not just cliched to say, it really is true. It's really important, if we're going to get it right, that we do it this way. This is a plan for Dorset, not a plan for Dorset Council.
Yeah. And when you do your cameo, even though it's just Dorset Council, you might just interleave a bit of BCP, because there's a lot of crossover, and I think that would be helpful for people. It would even be helpful for people to understand the tensions between Dorset Council and BCP, because you're probably not aware of some very, very significant tensions between us on what would appear to be something that we should all agree on.
Well, if I can just elaborate for the benefit of those on the call. So my own ward, West Parley, borders the BCP council area. And so whether that is in planning or health or anything from traffic movements, access to hospital, doctors, surgeries, all of that becomes a highly contentious issue. Because actually a lot of the rhetoric you see from the BCP area will talk about aspirations to become a city by the sea. The Dorset Council area wishes to remain semi-rural, rural in its constitute and the way it conducts itself. Those are the sorts of dynamics I was talking about earlier when I talk about on the fringes when we rub up against one another.
Yep.
And we need to address that. So yeah, we have to be very conscious of how we deal with these matters.
Right. I shall just switch Andrew off.
Yeah, I know. You don't start me here. You mentioned me.
And Patricia, I'll have one.
Of course, Andrew was making a play for a portfolio in the Place Directorate there for a moment. You're very welcome, Andrew.
Okay, so that was the update on the integrated care system. I think, and Chris, I'm particularly pleased that you made your input. Sam, come on in.
Thank you, Peter. I was just going to come back on Chris's excellent point. I think this is one of the issues that the Integrated Care Partnership needs to spend a bit more time working around, because one of the aims of integrated care systems, the fourth aim, is to think about how we can really work differently to promote that broader economic and social development, because the recognition is that that's what really affects, as you quite rightly say, the health and well-being of communities over the longer term. So we're at a very, very early stage in the thinking around that, but that's one of the issues that, for example, could be held by the ICP. But to deliver it, it absolutely needs to be done on the ground, working with communities and neighbourhoods. So there's that sort of going up to the top and then coming back down with some of these big issues. But it's a really, really important point, and quite a different way of thinking about what we could achieve by combining our resources and thinking quite differently. But above all, residents need to be at the heart of those conversations as well, don't they?
Thank you, Sam. Patricia.
So, thank you, Chair. Well, first of all, I wanted to thank Sam and his colleagues for all the work on the strategy, because it's been a great piece of work, and we haven't exactly done what we were asked to do centrally, but I think there's good rationale behind that. This is about doing the right thing for communities and not necessarily for organisations. And just to Chris's point, I think whilst much of the planning will be done at place level, the reality is that the delivery and the shaping of how services is delivered, especially in the social and economic development box, will be around neighbourhoods. So I think that's where the real meat of the work will be done. Just to Andrew's point, I'm conscious of the fact there are tensions, and there's something about thinking through, maybe as two local authorities, how we can smooth some of those tensions. We're doing the same thing between health colleagues, because apart from the fact we might have slightly different ambitions, we also have a responsibility to use public money wisely. And when we are duplicating on effort, that means that people are not getting guarantee of the same service and outcome. There is an issue with that, and that's one of the conversations I've started with the health providers, is that we shouldn't be duplicating service unless it's absolutely necessary, and we should all be working to the same specification, because it shouldn't matter what part of Dorset you live in. You should get the same experience and outcome. So I think we just need to think through what the tactics are to get everyone on the same page about the direction, but more importantly, the how, because the devil will be in the detail.
Patricia, thank you very much for that. And that gives me a really useful little note to Sam, to think that that's got to be some input to the joint development session, because that's the sort of input that nobody can disagree with, but people throw out of the window quite quickly. You know, they do say that battle plans suffer from immediate first contact with the enemy, and you know, we all have these yes we'll work, and then it doesn't happen. We actually need to what you've said is absolutely spot on, and we need to walk in and say, look, you know, if we argue with each other, the only person that's going to suffer is the customer.
Yeah.
So great, absolutely great. Are there any other points on item 11? If not, I'm going to close item 11, and I'm going to say to Patricia next time she must come in person and give me a piece of her chocolate. Sam, you want a piece of the chocolate as well? Go on,
I'd love
Sam.
a piece of chocolate, but I was just going to come in with a sort of a postscript, really. We haven't talked very much in this paper about a formal communications strategy or a formal launch for the integrated care strategy. I understand Kirsty Hillier is quite close to finalising some of the additional content. So there will be an easy read version of the strategy. I've seen a draft of it. It's looking very good. It's looking very straightforward. And there's also going to be a website which will have much more engaging content. So there'll be video case studies that talk in a bit more of a dynamic way about what why some of these issues are important, why we've started to try and address them in the way that we have in the strategy. So I think my understanding is that's imminent and almost ready to go, but there'll be a bit more of a formal, publicly visible launch, if you like, in the next couple of weeks.
Okay, that's really helpful. If you could make sure that every member of the Health and Wellbeing Board gets given a copy of that and gets folded in to the comms so they feel part of it. Right, are there any other items on item 11? If not, I'm going to close it. Oh, George is such a stickler for detail. He said, do I want to address the recommendation? Is it a recommendation? I've got.
Would you like the proposed adoption of them?
Right. I propose adoption of the recommendations. Right. Can everybody in favour, please show. If there's anybody against, can you raise your hand so that, right. Nobody against. You're not against. Oh, well done, Patricia. You nearly had me worried there. So it's approved NEMCOM. I'm going to move on to item 12, which is exempt business. There is no exempt business. So 2 things I want to say. Have a great day, great weekend when you come to it. We will meet again, I think, sometime late May when we'll have the development session. And I look forward to everybody taking part, having read the strategy and having a really open mind to be able to share goods, bads and all of that. Thank you for your time today. I'll say cheerio. Thank you.